Good afternoon again. It's my honor to introduce this WIN Global session. WIN Global means Women in Nuclear. Not only about medicine, but all things that have to do with nuclear. The first speaker will be my dear friend Sonia Sergieva. She will talk about SPECT-CT imaging with 99 Tc technetium PSMA in patients with prostate cancer. She is a professor and consultant of nuclear medicine in the Military Medical Academy in Sofia and head of Department of Nuclear Medicine in Sofia Cancer Center. She has been a member of WORM since 2005, and she is in the editorial board of the World Journal of Nuclear Medicine. And I am really very happy to introduce her to this talk. The second speaker will be Melina Belinko. Her talk will be about women in nuclear, over 25 years of promoting gender equality. She is also from Argentina, the Vice President of WIN Global 2020-2022. She joined WIN in 2014 and she became an active member of the Executive Committee of WIN Argentina. And she has been acting in the general co-chair of the joint IYNC WIN Global Annual Conference. She's a specialist in international cooperation with over 13 years of experience in technical cooperation, working at the main Argentinian institution, the National Atomic Energy Commission of the Republic of Argentina. And currently, she is a national liaison officer of the IAEA. From June 2016 to December 2017, she was appointed to undertake a special assignment to support the planning, design, implementation, and closure of both national and regional projects on the IAEA Department of Technical Cooperation in Vienna. She has been actively involved in several initiatives to promote gender equality in science, technology, and innovation. And she was acknowledged with the WIN Special Award of the World Nuclear Exhibition in 2018 in Paris. Actually, she is leading a project to build a WIN chapter in the region with the support of the Intergovernmental Region Cooperation Agreement for the Promotion of Nuclear Science and Technology in Latin America and Caribbean. Thank you, both of you, for your support to WORM, and thank you for sharing your knowledge.
Good afternoon, dear colleagues. It is my great pleasure to attend 15th virtual conference of WORM, and I would like to thank Mariela, my very close friend. I will present the results of our study, SPECT-CT imaging with technetium labeled PSMA in patients with prostate cancer. Authors disclose that there is not any potential conflict of interest. As you know, prostate-specific membrane antigen is a cell surface glycoprotein with a large extracellular domain with overexpression of the prostatic tumor cells. This membrane antigen is known as carboxypeptidase, the type 2 type protease with single factor, which is available in low concentrations in normal kidney, intestinal tissue, and salivary glands. PSMA overexpression is observed also in endothelial cells of tumor, neovasculature of non-prostatic solid tumors, and benign lesions such as colon, gastric, breast, thyroid, ovary, Paget disease, probably stimulated by secreted angiogenic factors. Upon ligand binding, PSMA is internalized via endocytosis. Development of small molecules of PSMA ligands or inhibitors binding to active site of PSMA was based on high specificity for receptors, higher permeability in solid tumors, improved pharmacokinetics in normal tissues, enhanced target-to-background ratio, easy to produce, easy labeling, no host immune response. Small molecules of PSMA can be labeled with different radionuclides with gamma emission for imaging, such as gallium PSMA, technetium or fluorine 18, or with beta emission for therapy, such as lutetium. A lot of small molecules were developed. Technetium-labeled PSMA is a new radiopharmaceutical from Poland company Polatom, small ligand binding to active site of PSMA. The purpose of our study was to evaluate the role of technetium-labeled PSMA for imaging of local regional metastases and or local relapse in patients with recurrent prostatic cancer. 36 patients with prostate cancer aged from 60 to 84 years with biochemical relapse of PSMA ranged from 0.03 to 62 nanogram per milliliter were included. 3 patients were studied after true-cut biopsy, hormonal and cytoreductive radiotherapy, and 33 patients after radical treatment, including total prostatectomy or definitive radiotherapy of the tumor. All of them underwent whole-body imaging examination with subsequent target SPECT-CT studies of the pelvis, abdomen, and or chest 1 to 3 hours post-intravenous administration of the tracer. This average activity dose was 6.3 megabecquerels per kilogram in a man of 70 kg. Double-head SPECT-CT camera with low-dose CT scanning was used. The images were interpreted based on all other clinical and radiological data. Follow-up could be conducted in 11 out of 36 patients during that period. Normal biodistribution of the radiopharmaceutical with high activity background was observed in the liver, spleen, kidneys, lacrimal and salivary glands, bowels, and urinary bladder. Positive imaging for local relapse in the prostate bed was imaged in 21 patients, lymph node metastasis in 16 cases, bone lesions in 10, pulmonary metastasis in 2, hepatic lesions were visualized in one of them, and in another, adrenal suprarenal metastasis with intensive tracer uptake. There was suspicious for local recurrence in 4 patients with negative MRT studies who were followed up. In 3 cases, previously treated bone metastases were partially negative without tracer uptake. Only some progressive bone lesions were positive. 5 patients were with negative result. Sensitivity of the study was 84%, specificity 100%, and accuracy 86%. This is the first clinical case of a man with low differentiated prostatic tumor with Gleason score 9. Radiotherapy and hormonal therapy were performed, but in January last year, PSA was very high. Whole body scan and target SPECT-CT imaging showed local recurrence and also enlarged pelvic, abdominal, also mediastinal and supraclavicular lymph nodes, and the small positive abdominal lymph node with diameter 8 millimeters were imaged. It shows a very high sensitivity of the study. This is another case of a man with prostatic cancer with Gleason score 8. Radiotherapy definitive were performed, also hormonal therapy, chemotherapy, and therapy with osteomodulators. In February 2018, PSA elevated. Whole body scan and target PSMA SPECT-CT imaging showed multiple bone metastases and also enlarged pelvic and abdominal lymph nodes. This is another case with locally advanced prostatic cancer, low differentiated with Gleason score 9. Biopsy and hormonal therapy were performed with elevation of PSA in January last year. Whole body scan and target SPECT images show enlarged prostatic gland and also perivesical lymph nodes corresponding with MRT images. This is another case of patient with Gleason score 7 of prostatic cancer after radical prostatectomy, radiotherapy and hormonal therapy. In March last year, there was elevation of PSA, whole body scan and target PSMA showed local recurrence of the disease and also single and large iliac lymph node on the left. In this image, you can see gross tumor volume and also clinical tumor volume delineation based on PSMA imaging results in radiotherapy planning. Radiation dose distribution in the region of the local recurrence and single and large lymph node on the left in the same patient was shown here. And in conclusion, it was summarized that SPECT imaging with technetium-labeled PSMA could be applied in patients with prostate cancer for the diagnosis of recurrent disease in order to determine personalized treatment for each individual patient, to follow up with patients after complex therapy and biochemical recurrence for restaging, for imaging of local recurrence and or metastasis after therapy in order to perform salvage radiation therapy or target radiotherapy. Specific uptake of this tracer depicted by SPECT images has clinical importance of identifying and assessment PSMA expression before consideration of radioligand therapy with lutetium PSMA. Thank you very much for your.
Hello, everyone. My name is Melina Belinco. I am the WIN Global Vice President. And first of all, on behalf of WIN, I want to congratulate and especially thank the organizers for this opportunity of raising awareness of the role of women in nuclear within the framework of this very important conference. So, as you may know, WIN is a global organization founded in 1993, which supports women working in various fields of nuclear energy and radiation applications, including, of course, those working in the area of human health, such as nuclear medicine, radiation therapy. WIN main goals are to promote gender balance with a special focus on young generations, as well as to raise awareness of the benefits of the peaceful uses of nuclear science and technology, in particular as a key component to solve the climate crisis. WIN acts as a global network. WIN has currently 35,000 members, including those from its 48 chapters, national, regional, and international ones, and individuals from 142 countries and regions. And it is fortunately still growing. It is important to highlight that there is no membership fee. Dominique Muyot and I had the honor to be recently elected to become the new president and vice president of WIN Global, respectively. This is a real privilege, and we are really motivated to keep on contributing to WIN vision. As you can see, our vision involves two of the main challenges of the 21st century: climate change and gender equality. In this regard, it is important to highlight that in order to become this forum, one of our main priorities is to promote the debate on the role of nuclear energy as a key part of the solution to the climate crisis, not only from a technical perspective, but also from a strategic approach. In addition, WIN, as a global association of women, makes great efforts to have an active involvement in the decision-making processes, as this also means gender equality. This is also part of women empowerment. We can then contribute to applying gender lens to the definition of policies and strategies so that our differentiated needs and perspectives are considered as real key components of the decision-making processes. Besides this, we consider it crucial to revalue the power of a collective construction, a crucial element to provide sustainability to every initiative, especially when working for gender equality. We also promote gender solidarity within our association. Our society has historically promoted enmity, competition among the diversity of women, so that we have not been able to develop strong tools for networking or teamwork among us. That's why we strongly believe that we need to set an example and boost solidarity and networking. It is also essential for us to promote diversity in our team, as it is key to enrich and ensure the success of any project, keeping also a balanced geographical and generational representation. In this sense, we also promote the interdisciplinary work, and as this will also contribute to demystifying stereotypes among people with different professional backgrounds. We also work to become an effective platform which responds to the main issues, real needs of women working in the nuclear field. In this regard, in order to effectively implement our initiatives, we promote an intersectional approach. Which acknowledges multiple systemic barriers due to gender, identity, race, economic status, immigration status, national origin, among other aspects of one's identity, because all these elements have an impact on the access to opportunities. For example, in many cases, racial minority women experience discrimination in a completely different way than racial minority men or even women as a gender. I would like to mention four of our main topics of our action plan, which we consider it especially relevant to highlight within the framework of this conference. These are communication, cooperation and partnership, involvement of young generations, and the promotion of the multiple application of nuclear technology. First of all, regarding communication, we define the young generations, women, and the general public as our main target audiences. As for the general public, we promote actions to engage them to demystifying nuclear and radiation applications. In particular, as for the young generations, we make efforts so that they get actively involved in the coordination and promotion of wind social networks. In addition, women also remain having the more negative perception on nuclear. Therefore, our communication plan involves a gender perspective. In this sense, we need to give visibility to the contribution of women to nuclear science and technology, as well as to raise awareness of the obstacles that we still face at every level. You may know the quote, "You can be what you can see," which was recently highlighted at a WIN regional event by a colleague from WIN Brazil, Janaina Dutra. In addition, as you know, science outreach has a key relevance, especially in the current context of science denialism. WIN contributes to bridging the gap of understanding between the nuclear community and the society as a whole. Specifically, we develop audiovisual material with solid, attractive content, taking advantage of the efforts already made by other networks of young generations and other partner associations, as well as WIN chapters. For instance, within the framework of the global initiative Stand Up for Nuclear, WIN chapters from Latin America and the Caribbean were actively involved by organizing online festivals last September. It has been a fantastic experience to produce quite interesting and innovative material, both on the promotion of nuclear science and technology and gender equality. Our plan also promotes the steady presence of wind by taking an active part not only in key events in the field of science, technology, and innovation, but also activities in which gender issues are addressed, as this is also an effective strategy to reach the general public. In order to implement our action plan, we continuously seek to promote cooperation agreements with other organizations, especially from the nuclear sector, such as the WNA, IYNC, ICRP, IRPA, and recently Thomas Tor Associates. In addition, we have also strong collaborative ties with several entities, especially with the objective of setting up special interest groups for nuclear careers and opportunities. For instance, the IAEA, the World Institute for Nuclear Security, WINS, Environmental Progress, Nice Future Initiative, Women in Aerospace, Mothers for Nuclear, the Agreement ARCAL, among others. The third topic to be highlighted is related to our work to attract and consolidate WIN Global Young Generation as a group of interest within WIN Global. We promote the nuclear sector as an interesting, technological, and innovative field where they can find first job and develop a career. We give priority to enhance the collaboration with IYNC, the International Youth Nuclear Congress Association, with whom we co-organized a joint conference in 2018 in Argentina. We also launched activities of interest for young people, such as mentoring programs, job opportunities, technical visits. And we make strong efforts to strengthen actions for supporting professional development of young women, such as the Nuclear Future Award, which consists of sponsorship for an individual who has demonstrated outstanding commitment to WIN Global and its chapters. In this way, WIN encourages young generations and provides support so that this person can attend WIN annual conference in which he would otherwise not be able to take part. And the last topic I would like to highlight is the work of WIN to promote nuclear technology applications such as medicine, art, agriculture, through our presence in 142 countries. We consider it key to raise awareness on the diversity of applications of nuclear science and technology by launching initiatives which give visibility to other peaceful uses in addition to electricity generation, which also have a direct positive impact on the people's quality of life. This is an essential component of our action plan in order to promote a fluent dialogue with the society and to contribute to the global effort to getting the social license, the social acceptance of the general public. And to conclude, I would like to mention some key takeaways with the objective of boosting a constant reflective exercise. We find it crucial to bridge the generational gap and make the most of experienced women and senior leaders so that they can act as role models and facilitate motivating opportunities for professional development, especially for young women. We, as women who have the responsibility of being involved in decision-making environments, need to be strongly committed and set an example. In addition, it is also essential to strengthen the interdisciplinary work. Diversity is key to enrich and ensure a successful project, and also to break stereotypes among people with different professional backgrounds. In this sense, social sciences are a key component to develop a communication strategy from a gender perspective. It is necessary to elaborate a compelling narrative to engage the general public, especially women and young generations, and to facilitate the active participation of every group and individual in this collective process. We also need to raise awareness among the general public so that we all understand that gender inequality is a socio-cultural matter. There is a social-cultural construction on the role of women and the role that women should play in a society that keep us away from decision-making positions and environments, and from developing professional careers in STEM fields. This aspect is related to the female subjectivity, which is also socially constructed and is part of the collective imaginary and of women's ourselves who are raised to be mother or to carry out domestic tasks according to established stereotypes. So lack of self-esteem, fears, or insecurities are also elements of the education we receive from kindergarten. As for the institutional level, most regulations, statutes, organizational charts are elaborated by and for men. So women naturally enter in a more hostile environment where the lack of gender consciousness prevails. Therefore, it is key to provide women with concrete tools to identify these disparities and stereotypes which are naturally accepted without questioning, thus being so difficult to recognize and address, no matter the area of the nuclear field we are working in. And that's why also training programs, both in gender issues and in leadership, are so important. It's difficult for us women to recognize ourselves in leadership positions, and some women consider this position having negative connotations since they link them to authoritarianism. So therefore, finally, the society in general has to be part of this process so that these initiatives can be reflected as public policies. As I mentioned, our society has historically promoted enmity among the diversity of women, so that we have not been able to develop strong tools for networking or teamwork among us. That's why I would like to emphasize on the role of WIN as a network for women. It is essential to promote solidarity and networking as we clearly share a common identity, common goal, struggle with the same issues as part of this society, and in particular, as women working in the nuclear field. So thank you very much for your attention, and we look forward to having you as active members of WIN and encourage you to be part of this collective construction. Thank you very much again.